पानी वानी पिलाओ.
मैं यहाँ बैठूँ करेगा ना.
Good evening. I am Dr. Josheata Pandita from Fortis Hospital Medical Services team, and I welcome all of you on the live chat. I have with me Dr. Gurneet Singh Sawhney. He's our senior consultant in neurosurgery. Welcome, sir, to the portal. Could you just give
Thank
us
you.
a brief
Yeah,
introduction?
thank you, Josheata. Thank you so much for inviting me for this talk. And thank you everyone for joining. And good evening to all. So let us go ahead and let us tell you something about neurosurgery, which is very dear to my heart. Yeah, ask me, Josheata.
So, sir, just give us a brief introduction about yourself first, please, to the viewers.
Okay, definitely. That was probably not required, but still, okay, let me tell you. So to all our viewers, I am Dr. Gurneet Singh Sawhney. I am an MS MCH neurosurgeon uh, from St. John's Institute of Health Sciences. This is way back. So I was the university topper at that time. After which I continued in my alma mater institute, and um, uh, and I became an assistant prof there. So working on through my journey, I went to Japan for doing a fellowship in functional neurosurgery under Professor Taira, and again a fellowship in Japan itself. This was in epilepsy surgery under Dr. Sugano. Also, I have done fellowship in neuro-oncology and neuroendoscopy. After which, I thought, let's move ahead of this, and after getting invited for joining here in Fortis, as I am a Mumbaiker. So for 10 years, I was in Bangalore and finishing all this, and then Fortis called me. I joined here way back 5 years back, and from that time, I am associated with Fortis Mumbai Mulund, and continuing my journey again during this course. Some of the accolades and awards came up, like the most promising neurosurgeon in Maharashtra. Also, the, this was by the Times Group. Also, the most so also another award which was post COVID, which I got for the work in COVID for neurosurgery. So that's how it is, and now I'm just talking to you for the same. Yeah. Tell
Thank
me.
you so much, sir. Thank you for this wonderful introduction. So, coming to the today's topic, it's more to neurosurgery. So, sir, could you just tell me what is more on this neurosurgery thing? What all is
Absolutely. 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 So what is important here? So what is more to neurosurgery? So neurosurgery, as a general perspective, everybody feels that it is about the brain and the spine. and But neurosurgery, as a big umbrella, is divided into multiple subspecialties, multiple, to the extent that every part of neurosurgery, every part of the type of the disease, there is a subspecialization which people go and do. For example, neuro-oncology. So as I'm a fellow for that. So where dealing with brain tumors, which will be cancerous or non-cancerous. Other types is functional neurosurgery. Then it is neuroendoscopy. Then it is spine surgery, pediatric neurosurgery, neurotrauma, uh, neurovascular surgery. Huh? So there are multiple branches in neurosurgery where people are trained further on after neurosurgery, and they do subspecialization, and there is great work going around the world for these particular sub branches. which people don't know. So this is more to neurosurgery. Also, not just this, the neurosurgery has advanced to such an extent that, which I would tell you along the course, that it has not just remained uh, to the basic principle of saving life,
Right.
or basic principle of just removing that part of the tumor. It's more than just the surgery. Also is a part of this also, I will tell you. Yeah.
Great. So, sir, as you said, neuro-oncology. So, could you just give us a brief about what is neuro-oncology?
Yes. Okay. So going to the subtypes of neuro-oncology, oncology means tumors.
Right.
Now, uh, as an oncosurgeon, so there are surgical oncologists which do surgeries of tumors throughout the body, but uh, they are they cannot operate in the brain. So in the brain, the oncologist is going to the oncologist is a neurosurgeon, because
Right.
there is a different principle altogether when we operate in the brain, the tumors in the brain. So the tumors can be malignant, that is
Mhm.
cancerous, or it
Right.
can be non-cancerous or benign. Depending upon the position of the tumor, there is a lot of change that happens. There are multiple ways that we operate. That is either by doing a craniotomy, or removing the part of the skull, or a keyhole surgery where we
Mhm.
remove the tumor from the nose, or the surgery where by just doing a biopsy is called a stereotactic biopsy. So there are multiple ways, and endoscopy surgery. So
Right.
there are multiple ways that we do surgery in neuro-oncology. So that is all about in a small of neuro-oncology. Yeah,
Okay.
yeah, Josh.
Yes. So, apart from neuro-oncology, we talked about skull-based neurosurgery. So that is itself a very different thing. So, could you just explain us what is skull-based neurosurgery, sir?
So what happens? The skull is attached to the face.
Right.
The brain is just above the face, so
Right.
above all the things that we have on the face. So what is the base of the skull is where the brain rests. And so the tumors which arise at this base, which I am not able to approach it, like if I have to operate on a skull base tumor, then
Mhm.
I cannot go directly. I'll have to lift the brain and then go and operate,
Right.
which becomes very difficult. That's why there are many ways that skull-based surgery is done. Is mainly, as I told you, by endoscopy through the nose. We go
Mhm.
inside and remove the tumor of the brain. So that is a skull-based surgery. We do a small keyhole surgery here, and we remove the tumor there. Similarly, on the other parts is skull-based neurosurgery.
Okay. So now we are talking about skull base. So just moving ahead to neurotrauma.
Ah,
So what is
okay. So
yeah, linking it to neurotrauma?
So trauma is one of the very important part of neurosurgery. The reason that neurosurgery is at such a level is because of neurotrauma. Because, see, trauma or road traffic accidents, they are very common. Uh, After a trauma, we find that there are about 33% of the traumas are related with head injury, out of which, if you take total head injuries, and about 18% of them will be related to spine. So brain and spine together uh, are about 18% of all. And so in all, if you see, if there is a trauma, there is going to be some injury to the head. And this becomes a life-saving thing. A patient of trauma has to be operated, attended is immediately, and what procedures have to be done, whether to operate at this stage or later. So these all come in the bracket of trauma, of neurotrauma. Also the spine trauma, which happens along with that, uh, also comes in that, so that we can so that's also a specialization in neurosurgery, where trauma particularly is
Mhm.
taken care of.
So
Yes.
spine surgery. So we are talking about spine surgery. So this is a totally a different field than a neurosurgery, or
Um,
it's a super
so I'll tell you.
specialized.
Yeah. So I'll tell you. So every neurosurgeon is
Mhm.
also a spine surgeon. Yeah. So a spine surgery is so there is a subspecialization on spine where
Mhm.
we have moved from an open spine surgery to a minimally invasive spine surgery, where the long cuts are not nowhere to be done. We can use it by something called as tubular retractors, or an endoscopy. So with that, we are able to deal with the spine, and all the instrumentation or screws that we put. This has all changed the scenario of the patient being in the hospital for a limited number of days. The pain is less, the patient's recovery is fast, patient gets home in a few days, 1 or 2 days, 3 days. So this spine surgery, as under we call it as neurospine surgery, is also a subspecialization which comes under neurosurgery umbrella.
Okay.
Yeah.
So nowadays, a lot of pediatric patients have come up, and the pediatric neurosurgery itself is a very growing field. So,
Mhm.
could you just give us a brief insight on that?
See, one thing we have to all remember, that
Mhm.
children are not young adults.
Right.
So we cannot treat them in the same way as we treat adults.
Right. Agree.
That's why the pediatric branch is completely different from general medicine.
Mhm.
Similarly, pediatric neurosurgery is completely different from general neurosurgery,
Right.
in which we deal that the type of the tumors that the patient that the pediatric child faces is different from adults. The approaches are different,
Mhm.
the treatment is different. And I remember that one of my patients who had come
Mhm.
from other country, Mauritius, with a large brain tumor in the brain stem or the pons area, which is considered as a very very crucial area.
Right.
Denied
Right.
surgery at multiple places, and then taking that approach, we operated the patient, and the child is fine today. It turned out to be a low grade cancer. For the benefit on that, it was looking to be a very high grade. So the approach was different.
Right.
The way that it was treated was different. So that's why pediatric neurosurgery is a different kind of a subspecialty. True.
Great. Sir, talking about the same, just wanted to understand what all treatments are available right now for pediatric neurosurgery in India, in specifically in Fortis also.
Ah, so, for pediatric neurosurgery in Fortis, we have got all the armamentum that is required. First, not just the OT, the microscope specifically, not just the neuronavigation. Also in pediatrics, all the instruments that we require is also on a different level. Not just the operation, the post-op care is also very important. So the pediatric ICU that we have is
Mhm.
so very well with our to get great pediatric ICU doctors. Now they do a phenomenal job, and with all the patients, let it be trauma, let it be any other emergency, or let it be elective, they are able to assess and get the patient better. So now that is important for why I always say that in neurosurgery, surgery is not the only part. It is
Right.
all other part which is also very important. It's not just the work of one person. It is the work of a
Mhm.
team which we have in Fortis,
Mhm.
and which we are able to deliver such good results.
Right.
So that's all. Yes.
Sir, one more new emerging topic coming up is the peripheral nerve neurosurgery.
Uh-huh. Yes, yes. So peripheral nerve surgeries uh, are done for the patients who have got nerve injuries after
Right.
trauma. So after trauma,
Right.
when you say, so here there is something called as brachial plexus,
Yes.
or a group of nerves which control your hand, or the group of nerves which control the leg.
Yes.
Now, after an accident where your hand gets stretched, these nerves get damaged, and the nerves don't work, for which then the nerves are cut. So these nerves are usually are delineated, are either joined, or we take a nerve transfer from one side to the other, so that the power of the hand is regained by the
Okay.
patient. So it is a big specialization where things are done, and in Fortis we have our doctors who do this specifically, the peripheral nerve surgery,
Right.
and save the limbs of the patient. Yes.
Okay. So one more thing is our functional neurosurgery. So
Yes.
that is
Yeah.
itself again a very big topic. So if you can just give us a brief on it.
So functional neurosurgery is very close to me because I am a functional neurosurgeon.
Yes.
so, so functional neurosurgery itself is very big. Now,
Right.
what actually is functional neurosurgery is where we try to, and while removing or doing anything, we try to save the function of that part of the brain. For example, uh, awake brain tumor surgeries. Now, in Fortis, I'm able to do a tumor surgeries uh, in which the tumor is located in the speech area of the brain, or in
Right.
the area of the brain where there is hand or leg,
Mm-hmm.
where that's called the motor cortex. So in these patients, we do awake surgeries where the patient is talking to us while we
Mm-hmm.
are operating. So the patient is able to give us the feedback when the operation is going on, and we are able to save that area, find out that area, which is the we call it as brain mapping. So we map
Right.
that area where the speech is, we map the area where the hand power is there or leg power is there. So it's a fantastic thing. So during the talking, we for mapping, we give a very small stimulus there, and we find that the patient, uh, while talking, he suddenly stops, and then we come to, and then we remove the stimulus, the patient starts talking again. So that
Right.
area which is well defined, which we come to know, we save that area, and then we operate on the surrounding area, and that's how we save the function. Other things about functional neurosurgeries are the surgery for movement disorders. Now, what are these movement disorders? Now, these are Parkinson's disease,
Right.
where the patient is having tremors, is having rigidity, not able to do their work, or the patients like dystonia, where you would have
Mm-hmm.
seen patients who have got the neck straight or the hand turned, right? So
Right.
so the and the other patients are the patients which we call it as tremors. They have got essential tremors. Their hand keeps on shaking. Like if they take a glass of water, they cannot drink it. So for this, we do surgeries in the brain, where we do something called as deep brain stimulations, and this is a highly specialized surgery, where by doing a small hole in the brain, we call it as a burr hole, we put an electrode in the specific nucleus of the brain, which controls that area. Now, this is also an awake surgery. Now, when we are
Mm-hmm.
doing it, we uh, give the stimulus, and we find that the tremors have stopped. We on the table,
Right.
and then we fix that deep brain stimulation electrode there. That is one of the surgeries that is mainly done for Parkinson's disease. For the other patients, we can do something called as lesioning. Now,
Mm-hmm.
lesioning is that specific nucleus or that specific circuit of the brain which is hampered, which is giving rise to these all tremors and movements. We go and stop that. There's one specific disease which we call it as focal dystonia. That means The focal means on the hands. And the patients who have got a lot of writing
Right.
in their life, they are office bearers and they write. They get some abnormal movement in the hand and they cannot write. The hand movements are like that. Or there's something called as musician dystonia. The patients who are playing guitar, the patients
Guitar.
who are
Right.
playing trumpet. So these patients they get because of overuse of their fingers, they get something called as musician's dystonia. The hand keeps on moving like this. They become tight. They cannot able to do that. So this operation we do it in the operation theater where the patient is playing the music,
Okay.
and while the music is being played, we do that lesioning where during the operation we will find that the patient's movement has become better and is going to play well. So there are so many of patients who become very good, and the general public does not know. There's so many medical students and others who they come to me, they say that they are unable to write and they don't know why.
Mm-hmm.
They're writing and they find that their hand has become so tight that they're not able to write. The handwriting is changed. So this is called writer's dystonia, which people don't know of. And there is treatment available. The
Right.
small people become better, they become normal to their life. Other thing is an epilepsy surgery that also comes in the umbrella of functional neurosurgery.
Mm-hmm.
Now there are so many patients of epilepsy. Epilepsy is fits, convulsions, जो
Right.
होता है. So उसका treatment has to be done in a right time. When we find that the medicines are not working,
Mm-hmm.
then we have to put them after a particular test and find out whether which part is this epilepsy coming, and we go
Mm-hmm.
and operate that area and the patient becomes fine.
Right.
There's so many examples in India. If you say the epilepsy patients are the number of epilepsy patients are too many, but nobody comes
Ah,
for the surgery because there is a lack of awareness.
right.
So that's the whole thing that we have this meeting today,
Yes.
so that I
Yeah.
can tell you there are so many things that are there in neurosurgery, which
Mm-hmm.
are just uh, people who don't know of. Yes,
Yes. So, any interesting case that you would like to tell us about any patient?
true. I will tell you. I'll also tell you about something called as vascular neurosurgery. Now which is also one of the part which I would want to talk to you about, and then after that I'll tell you interesting case.
Sure.
Or I can tell you many interesting cases.
Yes.
So so um, the vascular surgery is like we have a bypass in the heart and everybody knows about it. So I really like that the awareness about the heart in our society is very good. So that is one thing. That's so all the cardiologists, the cardiosurgeons have taken that effort and given so much awareness to them. So as there is bypass in the heart, there is also bypass in the brain.
Right.
So we do
Right.
a bypass in the brain for specific diseases where the brain blood supply has become down over time, and then the facial artery is taken inside and do bypass. We have that also. We do it in Fortis. So some of my patients who have undergone this. Other something called as endovascular neurosurgery, where from inside, like the stenting happens in the heart.
Mm-hmm.
So there are stents which can be put same in the way in the brain. There are something called as aneurysm which ruptures and then patient has brain hemorrhage. For that, there is coiling procedure. So these all things are also a part of endovascular
Right.
neurosurgery, vascular neurosurgery. Hello. Yeah, can you see me?
Yes. Yes. Definitely. Please continue.
Yes, yes. Uh, so coming to a specific case that I wanted to tell you, which happened just now. He came for follow up today itself.
Mm-hmm.
Now he
Okay.
So he was again a case of which 1 week back, sorry, 10 days back. Today's 25th,
Mhm.
15th. I had operated on him with a tumor in the brain, which is a large tumor, and this
Okay.
tumor was was from his speech area on the left side to his motor area. It was a very large tumor, but it was a low grade tumor, a tumor where we had to uh, where he uh, where the if we operate this tumor and the patient becomes cured, it's like it's a low grade tumor. So for this patient, I did an awake surgery. And I still remember that when I spoke to when I spoke to him about awake surgery, so he was very enthusiastic. He was very much into, and in the operation, the patient's cooperation is the most that we require. Now he
Right.
knows that. Now the patient knows that we are operating on his brain and he is awake and we are able. He's talking and so so during this operation, he supported very well.
Mhm.
After the operation, he was uh, so after this operation, he had a little of, because when we operate on the brain, there is always the brain tissues get moved, and then you have temporary
Mhm.
speech deficit, you have got temporary weakness. And today when he came to my OPD after 10 days, it was all normal, walking and
Mhm.
talking, and this with no tumor. So that was very exciting.
Very nice.
uh, so another case that I'll tell you is something called as CV junction.
Okay.
So there is a craniovertebral junction, that is the junction between the skull and the spine.
Mhm.
So that area is very 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 sensitive, right?
Okay.
So a young child of 11 years had this problem from before. They did not know, and when he came to me, he was uh, paralyzed
Mhm.
completely. He had a small fall, and this became completely pinched, and he
Mhm.
was paralyzed, for which and he was in a state where he was awake. He knew that he was paralyzed, not able to move. So at that situation, we took a chance. We
Mhm.
operated on the patient. We released whatever tissues was there, whatever was compressing. We did the surgery, and today now he's about 6 months after the surgery, 6 8 months, and he's back to his school. He's
Wow.
walking.
Wow.
So it is amazing. It is amazing. So there's so many stories. Uh,
Definitely, definitely.
for for a so there was a one of my doctor friends.
Mhm.
He he was a young when he was 36 years, and
Okay.
he had Parkinson's disease.
Oh.
So he had Parkinson's when at the age of 29,
Oh.
and the Parkinson symptoms
Mhm.
increased. He had to leave his practice. He
Okay.
couldn't um, he couldn't open his clinic and all. And then when he came to me, so we did a deep brain stimulation on him, and after that, now there is tremendous improvement. That's about 1 year that I have operated him, and
Okay.
he has opened his clinic. He is back
Mhm.
to his
Nice.
life. So that is important. Getting back to life is very very
It's
important,
important.
and if we are able to do that, then that is a lot of satisfaction that we get. Yes.
Right. So one more question, sir, because as we talk about neurosurgery, so is it difficult to motivate patients or take their consents regarding the treatment plans? How difficult it is?
uh, so I'll tell you one thing. I don't feel that it is difficult. I
Mm-hmm.
feel that if we are true to
Right.
what we are telling the patient,
Mm-hmm.
and we are realistic,
Right.
and patient knows what are we dealing with
Right.
and what can happen,
Mm-hmm.
uh, what am I going to do, and what I cannot do.
Right.
See, human beings have got a limit, right?
Agree.
There are a lot of things that are beyond our control,
Definitely.
right? So I always tell this. I can always tell you what am I going to do, but I can never tell what is going to happen.
So
Okay.
true. Right.
So what can happen also if the patient knows and the
Mhm.
relatives know, then uh, then there is no problem in the consent. What the patients should have, one is
Mhm.
trust in the doctor,
Right.
and second is
Mhm.
faith on the system and on God, and everything goes well. Now on this occasion only, so we had last month in June, on June 8th of this year,
Mhm.
and we had launched our support group for
Right.
brain tumor patients. So this was a
Right.
brain tumor support group, brain and spine tumor, neurotumor patients,
Right.
and there are so many people who came. Yeah. So it was actually a very, very short notice. In a day, we decided that we are going to launch the support group, and we invited limited. I still remember that the hall which we had taken, and there's so many people who came,
Mhm.
so many who
Mhm.
couldn't wanted to be online. There are and everybody had a story to tell,
Right. Right.
and the story was uh, like like रोंगटे खड़े हो जाए ऐसा story, huh? Seriously, and everybody had the story. How did they go through? What did
Right.
they went through? How they are better, uh, and uh, uh, and this is very important. Now these the support groups that we make, they help the other patients who would be going through all this,
Mhm.
uh, into they would help them sail through it. See,
Right.
everybody, whenever you go to some new place, we are scared. That's a
Right.
human tendency.
Right.
Now, so these groups help them. A doctor
Mhm.
is always there. We'll
Mhm.
always support them and tell them what is required. But patient to patient who have gone through it, that if other patients know, then it becomes very convenient. So that's what I
Right.
usually do. I tell them that, okay, you have this trouble, let's talk to somebody who has gone through it,
Yeah.
and then they get motivated, and then they are up on life. That's how it is. So I don't feel that it is very difficult to convince patients. Yes.
Definitely.
Yeah.
Okay, so sir, now post-operatively, what all precautions or care a person has to go through when we are
Mm.
talking about specifically the functional neurosurgery? So, what all precautions
Okay.
and what is the life after that?
Okay. Right. So and so very nice question, Joshita. You're asking such nice questions to me. Good. So see, post-operatively, patient, what restriction that we have in neurosurgery is nothing.
Right.
No restriction. Do whatever. Huh? I always tell
Mhm.
this to my patients. There is no restriction that you have to do. Now, what we have to take care for functional neurosurgery, like take it deep brain stimulation. Now, if you take that, there are implants in your skull, right?
Right.
So we have to take care of these implants. It should not get infected. That's what
Agreed.
we need to keep our area clean.
Right.
Similarly, there are a lot of myths that are there in after surgery, that you should not wash your hair,
Yeah,
you should
right.
you should not put water on this.
Mm-hmm.
So after your stitches are out, on the next day I tell them you wash your hair, and you keep your area clean. If you don't do that, then there is trouble.
Right.
Other myths are that you uh, don't eat potato, batata नहीं खाना है, और ये नहीं खाना है,
Yes.
sugar नहीं खाना है. So
Right.
न्यूरोसर्जिकली ऐसा कुछ भी नहीं है, सब खा
Right.
सकते हैं. डायबिटिक पेशेंट्स हो या hypertensive patients हो या any other patients who are there, they are everybody can go through these procedures, and everybody can become better. What you don't should not do is, don't leave exercise, don't
Right.
leave physiotherapy. Do your physiotherapy. Neuro rehabilitation is very, very important.
Right.
You get rehabilitated, get back to your life. Neurosurgery is not the end, it's the beginning. So you should not forget that. So I always operate on those patients who are well motivated, and age
Motive.
is not a figure. I've
Definitely.
operated at 90 years
Mhm.
of a patient. Now there was 84 years of a
Mhm.
lady who had come with a spinal tumor.
Okay.
Now his family was worried that, okay, she that how the surgery will go. There's a spine
Mhm.
tumor, should we get operated or no? So I
Mhm.
told, see, this tumor doesn't look like it doesn't look like cancerous.
Mhm.
It looks like non-cancerous. And before all the symptoms started, how was she? So they told she was okay, she was very active. So at
Mhm.
83 she was very active,
Okay.
going around and doing all the things. So I told them, then definitely she should undergo surgery. I asked the patient कि क्या करना है. So she was from उल्लासनगर.
Okay.
तो हाँ, तो बोलता डॉक्टर साहब मुझको चलना है. So she was not able to walk. तो बोलता
Right.
मुझको चलना है, मुझको मेरा काम करना है. तो मुझको नहीं डिपेंडेंट रहना है किसी पे. So I told, ठीक है, फिर ऑपरेशन के बाद आपको फिजियोथेरेपी वगैरह करनी पड़ेगी. बोले कोई प्रॉब्लम नहीं. So I operated, the tumor was out. Fortunately, it turned out to be non-cancerous. And after, she got discharged on the third day, and she came back to the OPD for stitch removal, and she was running and coming. So I told, "Bhago to." So so, it was so exciting that I told, "Chal, let's take a photograph आपके साथ." I have that so that are one of the patients who was there. And
Self-motivated.
yeah, so when we made this group, and
Mhm.
she was not the person, she couldn't come. And why she
Okay.
couldn't come? Because she had gone roaming around throughout the world. Was in she was in America somewhere. So she told कि मैं अभी उधर जा रही हूँ. तो मैं बोला, अच्छी बात है.
Great.
So that's what it is.
That's
So
good.
physiotherapy should not be stopped. That's
Right.
important. Yeah.
Right. So, any further message to the viewers? We are just coming in to the end of the live chat. So, any message that you would like to give to the viewers, sir?
So So, to the viewers, I just want to say one thing, that trust your doctor
Right.
completely. No doctor would want harm of the patient. Every doctor wants to cure his patient. The ways are different. The ways
Mhm.
are so every doctor takes their own path to cure. So whichever doctor you go, uh, just have complete trust on the doctor, and the doctor is going to take all the efforts to take you forward. Also, uh, go to a place where we get we get everything under one roof. That's important. So what happens, people have aged patients, they are patients with cardiac disease, liver disease, kidney disease, along with tumors, along with brain problems. So when everything is there together, it becomes easier. Like in Fortis Hospital, we have everything under one roof.
Right.
uh, Not just neurosurgery subspecialties, but all specialties, right? So not just neurosurgery only with its subspecialties, which I enumerated so many. So, but all other specialties also there, and they are all there to help you at any given point of time. They are there. That is very, very important. So keep trust, have faith, and you will find that everything sails well. Yes. Yeah, that's
Great.
the only thing that I want to tell to my listeners, right?
Thank you so much. Thank you so much for such a wonderful insight today on neurosurgery. Thank you so much, sir. Thank you for
Thank
joining
you.
us.
Thank you.
Thank
Okay.
thank
Bye. Thank you for calling me. Thank you. Yeah.
thank
Okay.
you. Bye.
Bye. Bye. Bye.